Welcome to Altered Physiology Mechanisms of Disease 2. Here in episode 4, we will now turn our attention to focus on alterations of the pulmonary system. Now, in this first episode, we will define some basic terms around signs and symptoms of pulmonary disease. First, we'll start off by defining dyspnea. This is the feeling of breathlessness and increased respiratory effort. Individuals have a subjective sensation of uncomfortable breathing, and uh, it can occur at various times. So, orthopnea is dyspnea when a person is actually lying down. So, this once again may be present in individuals with certain types of cardiopulmonary diseases. Paroxysmal nocturnal dyspnea is an attack of severe shortness of breath and coughing that generally occur at nighttime, hence nocturnal, and paroxysmal means that it is intermittent. It usually awakens the person from sleep and may be quite frightening. Now, another common sign or symptom of pulmonary disease would be coughing. Coughing is a protective reflex that expels secretion and irritants from the lower airways. Now, you can have changes in sputum volume, consistency, or color that may also indicate underlying pulmonary disease. For example, if you see green or yellow phlegm, it's usually a sign that your body is fighting an infection. The color is derived from the white blood cells. Individuals with pulmonary disease may also have abnormal breathing patterns that are simply adjustments made by the body in an attempt to minimize the work of the respiratory muscles, such as the diaphragm. They include Kussmaul respiration, as well as Cheyne-Stokes respiration as well. Let's take a moment to define each of these. So with Kussmaul breathing, it is a deep and labored breathing pattern, often associated with metabolic acidosis. So this may be particularly common among individuals with diabetes who are experiencing diabetic ketoacidosis. It can also occur in the context of kidney failure. Now with Cheyne-Stokes respiration, this is an abnormal pattern of breathing characterized by progressively deeper and sometimes faster breathing, followed by a gradual decrease that results in a temporary stop in breathing, referred to as apnea. The pattern may repeat with each cycle lasting anywhere between half a minute and 2 minutes in total. Additional signs and symptoms of pulmonary disease. Individuals can experience either hypo or hyperventilation. Hypoventilation is decreased alveolar ventilation caused by an airway obstruction, chest wall restriction, or altered neurological control of breathing. It will result in an increased partial pressure of carbon dioxide in the arterial blood. This is referred to as hypercapnia. In contrast, hyperventilation is increased alveolar ventilation, which may be produced by anxiety, head injury, or severe hypoxemia, and causes a decreased partial pressure of carbon dioxide, referred to as hypocapnia. Additional signs include cyanosis, which is a bluish discoloration of the skin. This is second to a desaturation of hemoglobin, polycythemia, or peripheral vasoconstriction. Individuals can also have clubbing of the fingertips, which are highlighted on the diagram to the right of your screen. This is associated with diseases that essentially interfere with the oxygenation of tissues. Finally, chest pain is another symptom that can result from a number of issues relating to inflammation, for example, of the trachea, bronchi, ribs, or respiratory muscles. We'll end off this lecture by focusing on pulmonary edema. which is another consequence of pulmonary disorders. Pulmonary edema is excessive water in the lungs that is caused specifically by increases in capillary hydrostatic pressure, decreases in capillary oncotic pressure, or increases in capillary permeability. Common causes include left ventricular heart failure that increases capillary hydrostatic pressure in the pulmonary circulation, inflammation of the alveoli, or lymphatic obstruction. All of these are common causes, once again, for the development of pulmonary edema. This flow diagram further highlights these common causes leading to pulmonary edema. And that concludes this lecture episode.